I am Bernard Herschel. Before my retirement, I was the chief of HIV/AIDS at the Geneva University Hospital. You might call me an AIDS dinosaur who has followed the HIV epidemic from the very first cases in the early 1980s through the triumph of antiretroviral therapies unequaled in the annals of medicine. Of course, this triumph has its flip side. Younger colleagues are no longer familiar with the opportunistic diseases and their myriad manifestations. Hence, the idea of these videos. After a short introduction, they will feature a series of images illustrating one or several exemplary cases from my files. AIDS-related dementia has many synonyms, such as HIV encephalopathy, HIV encephalitis, AIDS Dementia Complex, and others. It is thought to be due to the direct effect of HIV on the brain. The full-blown AIDS-related dementia usually occurs only in the severely immunosuppressed. Its frequency has declined with heart. However, lesser forms of motor and cognitive disease continues to occur. There are no pathognomic findings. Very often, the diagnosis is made by exclusion. This image is a T2-weighted brain MRI. Subcortical atrophy is revealed by the increased size of the ventricles. There is diffuse symmetrical hyperintensity of the white matter of both frontoparietal lobes. Extensive lesions of the white matter on brain MRI often contrast with the paucity of neurological deficit. The differential diagnosis is progressive multifocal leukoencephalopathy, or PML. A patient presented with early signs of AIDS-related dementia. A CT scan was essentially normal. 11 months later, however, marked brain atrophy is evident. A 35-year-old patient with a CD4 count of 35, never treated for HIV, and with moderate dementia. On the left, marked atrophy with enlarged ventricles and prominent sulci. On the right, a T1 weighted image after gadolinium enhancement shows diffuse low-grade uptake of gadolinium in the white matter. The brain of patients with full-blown AIDS Dementia Complex shows widespread moderate demyelination as revealed by pale blue toluidine staining. This is one of the cardinal features of HIV encephalopathy. Of note, the demyelination is of lesser magnitude than in progressive multifocal leukoencephalopathy. Here are the three cardinal features of HIV encephalopathy: microglial nodules, perivascular inflammatory infiltrates, and giant cells. AIDS Dementia Complex occurs in children. This 5-year-old patient from Thailand presented with convulsions. Brain atrophy was evident on transverse and coronal slices of the MRI scan. As in adults, brain atrophy is a typical finding in HIV encephalopathy. This video is part of a series on opportunistic diseases in HIV/AIDS. I'd be grateful for any feedback that you might have. If you are interested, please subscribe.